Bismillahirrahmanirrahim. In the name of Allah, the most beneficent, the merciful. The DRAP Act, 2012. Respected fellows, all of our video lectures are also available in written, PDF and text form in the comments under the relevant video at our YouTube channel, Pharmacy Jobs and MCQs. So, you can take or study the written lectures in the comments. We will discuss 3 things here. 1. 110 important facts about DRAP Act, 2012. 2. The complete article DRAP Act, 2012. 3. Solved MCQs about the DRAP Act, 2012. Let's start. DRAP Act, 2012, in Pakistan refers to the Drug Regulatory Authority of Pakistan Act, 2012. The Drug Regulatory Authority of Pakistan (DRAP) is a government body responsible for regulating the import, export, manufacture, pricing, and quality control of pharmaceutical products and medical devices in Pakistan. Important points about the DRAP Act, 2012 Drug Regulatory Authority of Pakistan, Act 2012 are as follows. 1. Establishment. The DRAP Act was enacted in 2012 to establish the Drug Regulatory Authority of Pakistan as an autonomous and independent regulatory body. 2. Regulatory functions. DRAP is responsible for regulating pharmaceuticals, biological products, medical devices, and clinical research in Pakistan. 3. Drug registration. DRAP oversees the registration and licensing of pharmaceutical products and medical devices before they can be marketed in the country. 4. Pricing and control. The DRAP Act empowers the authority to control and fix the prices of essential drugs to ensure their availability and affordability to the general public. 5. Quality control. DRAP is responsible for ensuring the quality, safety, and efficacy of pharmaceutical products and medical devices through rigorous evaluation and monitoring. 6. Import and export. DRAP regulates the import and export of drugs and medical devices to maintain quality standards and prevent the influx of substandard or counterfeit products. 7. Clinical trials. The Act also governs the conduct of clinical trials and ensures ethical practices and patient safety during research studies. 8. Collaboration and coordination. DRAP collaborates with international regulatory bodies and organizations to harmonize regulations and exchange information related to pharmaceuticals and medical devices. 9. Compliance and enforcement. The DRAP Act grants authority to take legal action against violations of drug regulations and enforce penalties for non-compliance. 10. The Drug Regulatory Authority of Pakistan Act, 2012, established DRAP as an autonomous and independent regulatory body. 11. DRAP is responsible for regulating pharmaceuticals, biological products, medical devices, and clinical research in Pakistan. 12. It was enacted to ensure the availability of safe, effective, and quality drugs in the country. 13. DRAP aims to promote the rational use of medicines and healthcare products. 14. The Act governs the registration and licensing of pharmaceutical products before they can be marketed in Pakistan. 15. It outlines the requirements and procedures for obtaining drug licenses from DRAP. 16. DRAP is authorized to control and fix the prices of essential drugs to ensure affordability for the public. 17. The Act empowers DRAP to monitor drug pricing and prevent the unfair increase in drug prices. 18. DRAP ensures compliance with Good Manufacturing Practices (GMP) for pharmaceutical manufacturers. 19. The Act governs the import and export of drugs and medical devices to maintain quality standards. 20. It regulates the import and export of controlled substances to prevent misuse and abuse. 21. DRAP has the authority to inspect drug manufacturing facilities to ensure compliance with quality standards. 22. The Act outlines penalties for non-compliance with drug regulations, including fines and license suspension. 23. DRAP conducts post-marketing surveillance of drugs to monitor their safety and efficacy. 24. The Act establishes a pharmacovigilance center for adverse drug reaction reporting. 25. DRAP collaborates with international regulatory bodies to harmonize drug regulations. 26. The Act provides provisions for the registration of clinical research studies and ethical oversight. 27. DRAP ensures that clinical trials follow ethical guidelines and patient safety protocols. 28. It encourages innovation in the pharmaceutical industry by providing incentives for research and development. 29. The Act governs the labeling and packaging requirements for pharmaceutical products. 30. DRAP monitors drug advertisements to prevent misleading claims and false marketing. 31. The Act establishes an appellate board for resolving disputes related to drug regulation. 32. DRAP has the authority to issue guidelines for the registration and classification of pharmaceutical products. 33. The Act empowers DRAP to take appropriate action against the promotion and sale of counterfeit drugs. 34. DRAP ensures the quality of active pharmaceutical ingredients (APIs) used in drug manufacturing. 35. The Act outlines the criteria for the approval of new drugs and biologics. 36. DRAP facilitates access to essential medicines for special populations, such as the elderly and children. 37. It regulates the import and export of controlled substances used in medical research. 38. The Act governs the process of drug pricing adjustments based on international indices. 39. DRAP establishes a pricing committee to determine drug prices in the country. 40. It ensures that pharmaceutical advertisements comply with ethical and legal standards. 41. The Act defines the role and responsibilities of drug inspectors and regulatory officers. 42. DRAP promotes the use of generic medicines to reduce healthcare costs. 43. It maintains a national drug information database accessible to healthcare professionals. 44. The Act establishes a National Pharmacopoeia Committee for setting drug standards. 44. DRAP conducts regular inspections of drug distribution channels and pharmacies. 46. It collaborates with the World Health Organization (WHO) to strengthen drug regulation. 47. The Act outlines the requirements for labeling information on drug packages. 48. DRAP monitors drug recalls and ensures proper disposal of expired drugs. 49. It regulates the import of bulk drug substances used in drug manufacturing. 50. The Act prohibits the import, manufacture, or sale of unregistered drugs. 51. DRAP provides guidelines for the disposal of pharmaceutical waste to protect the environment. 52. It issues no objection certificates (NOCs) for the import of medical devices. 53. The Act ensures that drug advertisements do not make false or exaggerated claims. 54. DRAP regulates the production and sale of dietary supplements and nutraceuticals. 55. It establishes a mechanism for handling complaints related to drug quality and safety. 56. The Act allows for the fast-track registration of essential medicines during emergencies. 57. DRAP promotes research and development in the pharmaceutical sector. 58. It facilitates the registration of biosimilar products for the treatment of diseases. 59. The Act encourages the use of traditional medicine while ensuring safety and efficacy. 60. DRAP establishes a drug recall system for products found to be unsafe. 61. The Act ensures that drug manufacturers follow the Principles of Good Distribution Practices (GDP). 62. DRAP collaborates with healthcare professionals and organizations to raise awareness about drug safety. 63. It sets standards for drug stability testing to ensure the quality of products over time. 64. The Act outlines the requirements for conducting bioequivalence studies for generic drugs. 65. DRAP conducts workshops and training programs for drug manufacturers and stakeholders. 66. It enforces compliance with the World Health Organization's international drug codes. 67. The Act establishes a national pharmacovigilance program for drug safety monitoring. 68. DRAP reviews and updates drug monographs to ensure accuracy and relevance. 69. It establishes guidelines for the import and use of controlled substances in medical practice. 70. The Act governs the process of granting import licenses for drugs and medical devices. 71. DRAP collaborates with international organizations for drug quality assessment. 72. It ensures the availability of essential medicines in remote and underserved areas. 73. The Act outlines the process for granting licenses to wholesale and retail drug sellers. 74. DRAP conducts risk assessments for drugs with potential safety concerns. 75. It collaborates with academic institutions for research on drug safety and efficacy. 76. The Act provides provisions for the registration of homeopathic and alternative medicines. 77. DRAP regulates the promotion and sale of over-the-counter (OTC) drugs. 78. It conducts inspections of drug manufacturing facilities to check compliance with standards. 79. The Act outlines the process for renewing drug licenses and approvals. 80. DRAP ensures that drugs are stored and transported under appropriate conditions. 81. It establishes a national committee for the evaluation of drug shortages. 82. The Act promotes the use of electronic drug tracking systems to prevent counterfeit drugs. 83. DRAP collaborates with customs authorities to prevent illegal drug imports. 84. It establishes a national committee for assessing drug safety and efficacy data. 85. The Act governs the process of granting orphan drug status for rare diseases. 86. DRAP issues guidelines for conducting clinical trials on pediatric populations. 87. It collaborates with international regulatory bodies for joint inspections of drug manufacturing facilities. 88. The Act promotes the use of standard treatment guidelines in healthcare settings. 89. DRAP reviews applications for the registration of new medical devices. 90. It regulates the advertising and promotion of prescription-only medicines. 91. The Act provides for the establishment of drug testing laboratories. 92. DRAP encourages pharmaceutical companies to conduct post-marketing studies. 93. It ensures that drug promotion materials are evidence-based and scientifically accurate. 94. The Act outlines the process for obtaining import licenses for raw materials used in drug manufacturing. 95. DRAP collaborates with the Pakistan Medical Commission for Drug Safety Education. 96. It establishes a system for reporting adverse drug reactions. 97. The Act provides for the issuance of certificates of analysis for drug products. 98. DRAP enforces guidelines for the safe disposal of pharmaceutical waste. 99. It collaborates with consumer protection agencies to address drug quality issues. 100. The Act outlines the process for obtaining licenses for the import and export of narcotics. 101. DRAP conducts awareness campaigns on rational drug use. 102. It regulates the labeling and packaging of herbal medicines. 103. The Act establishes a National Committee for Drug Formulary Development. 104. DRAP provides guidelines for the conduct of clinical research studies. 105. It collaborates with the Pakistan Nursing Council for medication safety training. 106. The Act promotes the use of essential medicines in public healthcare facilities. 107. DRAP enforces the ban on the import and sale of spurious drugs. 108. It establishes a National Committee for Drug Price Negotiations with pharmaceutical companies. 109. The Act encourages the local production of essential medicines to reduce dependence on imports. Topic details. In 2012, the government of Pakistan introduced the Drug Act, a comprehensive piece of legislation aimed at combating the rising threat of drug abuse in the country. This act was a critical step in addressing the multifaceted challenges posed by drug trafficking, drug addiction, and related crimes. By implementing robust measures and regulations, the government sought to safeguard public health, promote social welfare, and protect vulnerable populations from the devastating effects of drug abuse. 1. Background and context. Prior to the enactment of the Drug Act, Pakistan faced a significant drug abuse crisis, affecting communities, families, and individuals nationwide. The illicit drug trade was rampant, leading to an increase in substance abuse and addiction rates. Criminal organizations profited from the illegal drug market, causing widespread harm to society and impeding the country's socio-economic development. 2. Key objectives of the Drug Act. The Drug Act, 2012, was designed to achieve several key objectives. A. Control of drug production and trafficking. The Act aimed to control and regulate the production, import, export, and distribution of controlled substances, including narcotics and psychotropic substances. Strict penalties were introduced for those involved in drug trafficking to deter criminal activities. B. Prevention and awareness. The legislation sought to raise awareness about the dangers of drug abuse, with a focus on educating the public, particularly the youth, about the adverse effects of illicit drugs on physical and mental health. C. Treatment and rehabilitation. The Drug Act emphasized the need for accessible and effective drug treatment and rehabilitation programs to support individuals struggling with drug addiction. D. International cooperation. Recognizing the transnational nature of the drug trade, the Act encouraged cooperation with international bodies and other countries to combat drug trafficking on a global scale. 3. Key provisions of the Drug Act. A. Controlled substances. The Act classified drugs into different schedules, based on their potential for abuse and medical use. This classification helped in determining the severity of penalties for their possession, trafficking, or manufacturing. B. Penalties. The legislation established strict penalties for drug-related offenses, with consideration for mitigating circumstances in certain cases. Harsher punishments were reserved for major drug trafficking and repeat offenders. C. Seizure and forfeiture. The Drug Act empowered law enforcement agencies to seize assets and properties acquired through drug-related crimes. This measure aimed to disrupt the financial foundations of drug syndicates. D. Rehabilitation centers. The Act facilitated the establishment and regulation of drug rehabilitation centers, providing professional treatment and care to those seeking help for addiction. 4. Challenges and future prospects. While the Drug Act, 2012, represented a significant step forward in the fight against drug abuse in Pakistan, challenges remained. Implementation and enforcement of the law across all regions of the country posed logistical and administrative hurdles. Furthermore, addressing the underlying socio-economic factors contributing to drug abuse required long-term efforts and collaboration between government institutions, civil society, and the international community. The Drug Act of 2012 marked a turning point in Pakistan's battle against drug abuse, reflecting the government's commitment to protecting its citizens from the scourge of illicit drugs. By controlling drug production, trafficking, and distribution, raising public awareness, and providing support for treatment and rehabilitation, the legislation laid the groundwork for a safer and healthier society. Continued efforts to address the root causes of drug abuse, coupled with effective implementation and international cooperation, are crucial in securing a drug-free future for Pakistan. Part 3. The Solved Multiple Choice Questions (MCQs) about the DRAP Act, 2012 are. Question 1. What does DRAP stand for in the context of pharmaceutical regulation in Pakistan? A. Drug Regulatory Assessment Pakistan. B. Drug Registration and Approval Process. C. Drug Regulatory Authority of Pakistan. D. Drug Review and Approval Panel. Answer. C. Drug Regulatory Authority of Pakistan. Question 2. When was the Drug Regulatory Authority of Pakistan DRAP Act enacted? A. 2006. B. 2008. C. 2010. D. 2012. Answer. D. 2012. Question 3. What is the main objective of the DRAP Act, 2012? A. Promote pharmaceutical exports. B. Ensure availability of essential drugs. C. Control drug prices in the country. D. Regulate medical device manufacturing. Answer. B. Ensure availability of essential drugs. Question 4. What type of products does DRAP regulate in Pakistan? A. Pharmaceuticals only. B. Pharmaceuticals and medical devices. C. Medical devices only. D. Vaccines and biologics. Answer. B. Pharmaceuticals and medical devices. Question 5. Which of the following is responsible for ensuring compliance with GMP for pharmaceutical manufacturers? A. Ministry of Health. B. Pakistan Pharmacopoeia Commission. C. Drug Regulatory Authority of Pakistan DRAP. D. Pakistan Medical and Dental Council. Answer. C. Drug Regulatory Authority of Pakistan DRAP. Question 6. What does DRAP ensure regarding drug pricing in Pakistan? A. Fixing maximum retail prices for all drugs. B. Controlling the prices of essential drugs only. C. Regulating the prices of over-the-counter drugs. D. Setting the prices for all patented drugs. Answer. B. Controlling the prices of essential drugs only. Question 7. Which committee is responsible for determining drug prices in Pakistan? A. Drug Pricing Committee. B. National Pharmaceutical Pricing Committee. C. Drug Price Control Committee. D. Drug Registration and Pricing Authority. Answer. C. Drug Price Control Committee. Question 8. What is the purpose of the National Pharmacovigilance Center under the DRAP Act? A. Promote herbal medicine safety. B. Monitor and report adverse drug reactions. C. Register all pharmaceutical products. D. Monitor drug sales and distribution. Answer. B. Monitor and report adverse drug reactions. Question 9. How does the DRAP Act handle the issue of counterfeit drugs? A. Establishing a separate division for counterfeit drug control. B. Conducting awareness campaigns for the public. C. Collaborating with customs authorities for inspections. D. Issuing strict penalties for drug manufacturers. Answer. C. Collaborating with customs authorities for inspections. Question 10. What authority does DRAP have regarding drug advertisement and promotion? A. Approving all drug advertisements before airing. B. Banning all drug advertisements on TV and radio. C. Ensuring compliance with ethical standards. D. Setting specific advertising budgets for pharmaceutical companies. Answer. C. Ensuring compliance with ethical standards. Question 11. What is the primary purpose of the National Pharmacopoeia Committee established under the DRAP Act? A. Setting standards for drug pricing. B. Evaluating drug safety profiles. C. Developing drug monographs and standards. D. Monitoring drug recalls and withdrawals. Answer. C. Developing drug monographs and standards. Question 12. What type of facilities does DRAP inspect to ensure compliance with quality standards? A. Drug distribution channels. B. Healthcare facilities. C. Drug manufacturing facilities. D. Academic institutions conducting research. Answer. C. Drug manufacturing facilities. Question 13. Which committee is responsible for evaluating and addressing drug shortages in Pakistan? A. National Drug Shortage Committee. B. Drug Supply and Distribution Committee. C. Drug Shortage Management Committee. D. Drug Import and Distribution Committee. Answer. A National Drug Shortage Committee. Question 14. What role does DRAP play in promoting research and development in the pharmaceutical sector? A. Directly funding research projects. B. Offering tax incentives to pharmaceutical companies. C. Collaborating with international research organizations. D. Setting research priorities for the industry. Answer. B. Offering tax incentives to pharmaceutical companies. Question 15. What type of drugs are considered for fast-track registration during emergencies under the DRAP Act? A. All pharmaceutical products. B. Generic and essential drugs only. C. New and patented drugs. D. Biologics and vaccines. Answer. B. Generic and essential drugs only. Question 16. What type of products does DRAP regulate besides pharmaceuticals? A. Medical devices and cosmetics. B. Medical devices and herbal products. C. Vaccines and biologics. D. Veterinary drugs and vaccines. Answer. Of medical devices and cosmetics. Question 17. Which of the following is the highest appellate authority for disputes related to drug regulation? A. Federal Investigation Agency, FIA. B. Appellate Board established under DRAP Act. C. High Court of Pakistan. D. Supreme Court of Pakistan. Answer. B. Appellate Board established under DRAP Act. Question 18. What is the role of DRAP in drug recalls? A. Issuing recall orders for all expired drugs. B. Coordinating with healthcare providers for drug disposal. C. Conducting investigations to determine the cause of recalls. D. Providing compensation to patients affected by drug recalls. Answer. C. Conducting investigations to determine the cause of recalls. Question 19. What type of drugs are considered for orphan drug status under the DRAP Act? A. Drugs for rare diseases with no available treatment. B. Generic drugs with limited market competition. C. Over-the-counter drugs with low sales volume. D. Drugs exclusively manufactured in Pakistan. Answer. A. Drugs for rare diseases with no available treatment. Question 20. What does DRAP aim to promote regarding drug use in Pakistan? A. Rational use of medicines. B. Increased use of brand name drugs. C. Use of imported drugs only. D. Use of drugs without prescriptions. Answer. A. Rational use of medicines. 21. What was the primary reason for introducing the Drug Act, 2012 in Pakistan? A. To combat rising drug abuse. B. To improve the country's economy. C. To promote international cooperation. D. To regulate the pharmaceutical industry. Answer. A. To combat rising drug abuse. Question 22. Before the enactment of the Drug Act, what challenges did Pakistan face regarding drug abuse? A. A decrease in drug addiction rates. B. A decrease in drug trafficking. C. A significant drug abuse crisis. D. An increase in drug production. Answer. C. A significant drug abuse crisis. Question 23. Which of the following is not one of the key objectives of the Drug Act, 2012? A. Control of drug production and trafficking. B. Prevention and awareness. C. Censorship of media content related to drugs. D. Treatment and rehabilitation. Answer. C. Censorship of media content related to drugs. Question 24. The Drug Act aimed to raise awareness about drug abuse primarily among which group? A. The elderly. B. The youth. C. The politicians. D. The law enforcement agencies. Answer. B. The youth. Question 25. What did the Drug Act emphasize regarding drug treatment and rehabilitation? A. Mandatory rehabilitation for all drug users. B. The need for accessible and effective programs. C. Rehabilitation only for minors. D. Outsourcing rehabilitation to private organizations. Answer. B. The need for accessible and effective programs. Question 26. Why did the Drug Act encourage cooperation with international bodies and other countries? A. To promote tourism. B. To combat drug trafficking globally. C. To establish trade agreements. D. To increase foreign aid. Answer. B. To combat drug trafficking globally. Question 27. How did the Drug Act classify drugs? A. Based on their color. B. Based on their taste. C. Based on their potential for abuse and medical use. D. Based on their popularity in the market. Answer. C. Based on their potential for abuse and medical use. Question 28. What did the Drug Act empower law enforcement agencies to do? A. Seize assets and properties acquired through drug-related crimes. B. Enforce censorship laws. C. Ban the production of certain drugs. D. Encourage drug use in specific regions. Answer. A. Seize assets and properties acquired through drug-related crimes. Question 29. What was the primary goal of establishing drug rehabilitation centers under the Drug Act? A. To generate revenue for the government. B. To provide shelter for homeless individuals. C. To support individuals struggling with drug addiction. D. To create job opportunities for healthcare workers. Answer. C. To support individuals struggling with drug addiction. Question 30. What were some of the challenges faced in the implementation of the Drug Act, 2012? A. Insufficient penalties for drug-related offenses. B. Lack of cooperation from international bodies. C. Administrative and logistical hurdles. D. Excessive enforcement by law enforcement agencies. Answer. C. Administrative and logistical hurdles. Question 31. The Drug Act marked a turning point in Pakistan's battle against what issue? A. Corruption. B. Drug abuse. C. Terrorism. D. Poverty. Answer. B. Drug abuse. Question 32. According to the article, what is the key to achieving a drug-free future for Pakistan? A. Implementing harsher penalties for drug offenders. B. Addressing underlying socio-economic factors. C. Promoting drug tourism. D. Encouraging drug use for medical purposes. Answer. B. Addressing underlying socio-economic factors. Question 33. Which of the following is not one of the objectives of the Drug Act, 2012? A. Control of drug production and trafficking. B. Prevention and awareness. C. Treatment and rehabilitation for all citizens. D. International cooperation. Answer. C. Treatment and rehabilitation for all citizens. Question 34. What did the Drug Act classify drugs based on? A. Their brand names. B. Their origin countries. C. Their potential for abuse and medical use. D. Their color and shape. Answer. C. Their potential for abuse and medical use. Question 35. What was the primary focus of raising awareness about drug abuse under the Drug Act? A. The elderly population. B. The law enforcement agencies. C. The general public, especially the youth. D. The politicians. Answer. C. The general public, especially the youth. Question 36. The Drug Act emphasized the need for accessible and effective A. Drug production facilities. B. Drug trafficking channels. C. Drug rehabilitation programs. D. Drug smuggling routes. Answer. C. Drug rehabilitation programs. Question 37. Why did the Drug Act encourage international cooperation? A. To promote drug tourism. B. To regulate international drug trade. C. To raise awareness about drug abuse globally. D. To combat drug trafficking on a global scale. Answer. D. To combat drug trafficking on a global scale. Question 38. What did the Drug Act empower law enforcement agencies to do in relation to drug-related crimes? A. Provide financial incentives to criminals. B. Seize assets and properties acquired through drug-related crimes. C. Offer legal immunity to drug traffickers. D. Encourage drug trafficking in certain regions. Answer. B. Seize assets and properties acquired through drug-related crimes. Question 39. The primary goal of establishing rehabilitation centers under the Drug Act was to provide support for A. Drug producers. B. Homeless individuals. C. People struggling with drug addiction. D. Healthcare workers. Answer. C. People struggling with drug addiction. Question 40. One of the major challenges faced in implementing the Drug Act was related to A. Political resistance. B. Logistical and administrative hurdles. C. Foreign aid. D. Lack of public awareness. Answer. B. Logistical and administrative hurdles. Question 41. The Drug Act, 2012, aimed to combat the rising threat of what in Pakistan? A. Terrorism. B. Corruption. C. Drug abuse. D. Poverty. Answer. C. Drug abuse. Question 42. The key to securing a drug-free future for Pakistan involves addressing what underlying factors? A. Administrative issues. B. Socioeconomic factors. C. Law enforcement agencies. D. Drug trafficking routes. Answer. B. Socioeconomic factors. Question 43. Which group did the Drug Act primarily focus on educating about the dangers of drug abuse? A. The elderly. B. The youth. C. The politicians. D. The law enforcement agencies. Answer. B. The youth. Question 44. The Drug Act emphasized the need for accessible and effective programs for what purpose? A. Drug production. B. Drug trafficking. C. Drug treatment and rehabilitation. D. Drug advertising. Answer. C. Drug treatment and rehabilitation. Question 45. How did the Drug Act aim to control drug trafficking? A. By providing financial incentives to drug traffickers. B. By raising awareness about drug abuse. C. By regulating drug production and distribution. D. By encouraging drug use for medical purposes. Answer. C. By regulating drug production and distribution. Question 46. What did the Drug Act classify drugs based on? A. Their color and shape. B. Their brand names. C. Their potential for abuse and medical use. D. Their origin countries. Answer. C. Their potential for abuse and medical use. Question 47. The primary goal of raising awareness about drug abuse under the Drug Act was to target which group? A. The elderly population. B. The general public, especially the youth. C. The politicians. D. The law enforcement agencies. Answer. B. The general public, especially the youth. Question 48. What was the primary focus of the Drug Act regarding drug treatment and rehabilitation? A. Implementing mandatory rehabilitation for all drug users. B. Establishing and regulating drug rehabilitation centers. C. Encouraging drug users to seek treatment voluntarily. D. Outsourcing rehabilitation to private organizations. Answer. B. Establishing and regulating drug rehabilitation centers. Question 49. Why did the Drug Act encourage cooperation with international bodies and other countries? A. To promote tourism. B. To regulate the pharmaceutical industry. C. To combat drug trafficking globally. D. To improve diplomatic relations. Answer. C. To combat drug trafficking globally. Question 50. What did the Drug Act empower law enforcement agencies to do? A. Seize assets and properties acquired through drug-related crimes. B. Enforce censorship laws. C. Ban the production of certain drugs. D. Encourage drug use in specific regions. Answer. A. Seize assets and properties acquired through drug-related crimes. Question 51. What was the primary goal of establishing drug rehabilitation centers under the Drug Act? A. To generate revenue for the government. B. To provide shelter for homeless individuals. C. To support individuals struggling with drug addiction. D. To create job opportunities for healthcare workers. Answer. C. To support individuals struggling with drug addiction. Question 52. What were some of the challenges faced in the implementation of the Drug Act, 2012? A. Insufficient penalties for drug-related offenses. B. Lack of cooperation from international bodies. C. Administrative and logistical hurdles. D. Excessive enforcement by law enforcement agencies. Answer. C. Administrative and logistical hurdles. Question 53. The Drug Act marked a turning point in Pakistan's battle against what issue? A. Corruption. B. Drug abuse. C. Terrorism. D. Poverty. Answer. B. Drug abuse. Question 54. According to the article, what is the key to achieving a drug-free future for Pakistan? A. Implementing harsher penalties for drug offenders. B. Addressing underlying socio-economic factors. C. Promoting drug tourism. D. Encouraging drug use for medical purposes. Answer. B. Addressing underlying socioeconomic factors. Question 55. Which of the following is not one of the objectives of the DRAP Act, 2012? A. Control of drug production and trafficking. B. Prevention and awareness. C. Treatment and rehabilitation for all citizens. D. International cooperation. Answer. C. Treatment and rehabilitation for all citizens. Question 56. What did the DRAP Act classify drugs based on? A. Their brand names. B. Their origin countries. C. Their potential for abuse and medical use. D. Their color and shape. Answer. C. Their potential for abuse and medical use. Question 57. What was the primary focus of raising awareness about drug abuse under the DRAP Act? A. The elderly population. B. The law enforcement agencies. C. The general public, especially the youth. D. The politicians. Answer. C. The general public, especially the youth. Question 58. The DRAP Act emphasized the need for accessible and effective A. Drug production facilities. B. Drug trafficking channels. C. Drug rehabilitation programs. D. Drug smuggling routes. Answer is C. Drug rehabilitation programs. Note: whole of the above lecture is also available in written, PDF and text form in the comments under this video at our YouTube channel, Pharmacy Jobs and MCQs. So, you can take or study the lecture in the comments. Thank you. Dr. Majid Body Pharmacist. PharmD, MPhil, LLB. Vice President, Pakistan Pharmacists Association PPA Punjab, 2023-2025. Contact +92 3214042036.